Hi everyone, welcome back to my channel again. Today I'll be talking to you guys about a very simple concept of occlusal trauma and localized advanced periodontal disease. In this particular video, you're gonna be seeing the X-ray, the occlusal view, and also the intraoral facial aspect of the case. This is tube number 6. Patient. As you test it, open and close, the tube number 6 is hitting hard on the lower, causing the advanced bone loss on the facial aspect as well as the distal aspect of this tube severely, and to the point where the patient economically he cannot afford to have immediate implant placement or gum surgery. So let me show you the X-ray first. You can see that severe bone loss around the tube area, more so on the distal aspect of the tube. But clinical evaluation, periodontal approach around, pretty much there's nothing left there. Look at the occlusal view. What you see is that tube number 6, a little bit more lingually tilted, but it's still reasonably normal in the way it looks. But if you look at the left side, tube number 13 and number 14, they have problem. Number 1 and number 13, he lost the tooth, the crown for a long time and never come back to any dentist to restore it. That lose the vertical dimension the same way at tube number 14. Look like he also lost another crown, and he also have periodontal disease of that advanced bone loss on that tube as well. So for young dentists, whenever you have a patient who come with some posterior teeth and they want to have tooth removed, just make sure that you educate the patient that if they lose posterior teeth, they will eventually lose anterior teeth. So in this particular case, the evidence show very well that patient have occlusal issue, tooth loss, bone loss on number 6 is due to the lack of balancing between the left and right occlusal and posterior teeth. It's very important to educate the patient to try to save the tooth, and also early prevention to prevent future problem. In this particular case, you learn the lesson that patient losing the balance of posterior teeth on number 14 and 13, which eventually causing the contralateral right side issue with trauma, and in this case it hit right on the canine. So frequent visits for dentist checkup routinely is important. Early intervention of any crown loss or any tooth need to be maintained to maintain the balance of the occlusion and posterior teeth is very critical for long-term stability of anterior teeth. Thank you for watching. This is just an example to show you more or less the basic concept of prevention, and early intervention is better than waiting for the problem arise, and then we have to tackle not only reconstruct the posterior teeth, but also now we have to challenge ourselves to fix the problem with the anterior aspect as well. You can also see that and due to the lack of posterior teeth balance, you can see anterior teeth have a lot of evidence of wear and tear on tube number 7, 8, and 9, and 10 as well, and even in number 11. So again, this video is for early new dentists, and as well as patient. If you watch it, you can see that when you missing back teeth, you will have front teeth problem. So make sure you talk to your dentist, have frequent visit and checkup. Thank you for watching. Have a good day. Thank you. Bye bye.